Future nurses, let's talk about benzodiazepines, okay? Benzodiazepines are central nervous system depressant medications. They enhance the effect of GABA. And what is GABA? So think about GABA as the brain's natural calming messenger. It tells overactive brain cells to relax and take a break, okay? So when GABA is stronger, the brain is quieter. There is less anxiety, more sleep, and fewer seizures, okay? So benzodiazepines help GABA works better, okay? Benzodiazepines are medication ending in PAM and LAM, okay? Like lorazepam, diazepam, oxazepam, and many others. Lastly, the only benzo that doesn't end with PAM and LAM is I hope I say this right, chlordiazepine. It is also a benzodiazepine, but it doesn't end with PAM and LAM. And need you to remember that because you can see that in your exam, okay? Now, what are benzodiazepines used for? They are used for anxiety disorders, such as generalized anxiety, panic attacks, okay? They can be used for insomnia, short-term only, okay? They can be used for seizures, such as the status epilepticus. So IV lorazepam or diazepam can be used for seizure. It can be used for alcohol withdrawal. They can also be used as muscle relaxants. And some benzodiazepines can be used in procedural sedation. That is, if they have procedures like endoscopy, the patient can be given benzodiazepines, such as midazolam before endoscopy, okay? Now, side effects / adverse effects of benzodiazepines, okay? They can cause central nervous system depression, such as drowsiness, confusion, dizziness, okay? They can also cause respiratory depression, especially when it's taken with opioids or alcohol, okay? They can also cause paradoxical agitation. This is rare, but it can occur in the elderly, okay? So this means that instead of the medication, instead of benzodiazepine calming the patient, benzo will actually do the opposite, such as agitation, restlessness, aggression, and insomnia. And this is because elderly brains can respond unpredictably. So if the agitation worsens, stop benzo immediately and report to the healthcare provider. And the healthcare provider can determine another alternatives for the condition the patient is using benzo for. Also, another side effect is dependence. The body can get used to benzo and may need it to feel good. It may need it to fall asleep, to sleep. So you have to monitor for that. Those are side effects of benzodiazepine therapy for too long. Now let's go to nursing consideration. For benzodiazepines, you have to taper them off gradually. Do not stop abruptly. Actually, any medication, do not stop abruptly, because they will worsen the condition you are using it for. If you are using benzo for anxiety and you stop it abruptly, it will worsen the condition you are using it for. It will worsen the anxiety. So do not stop abruptly. Also, benzo are to be used short term, because the body can depend on it to function. The body can, you may not be able to, if you're using benzo for insomnia, the body may keep requesting for it until you take benzo, you cannot sleep, okay? So use it for short term, okay? Now, avoid benzo with alcohol, opioids, antihistamines, and barbiturates. Why? Because taking all this with benzodiazepine can cause central nervous system depression. Also, monitor for fall risk in elderly, since benzodiazepine can cause sedation, so that can increase fall risk in elderly. So when your patients are on benzodiazepine. Also, teach your patient to avoid driving or operating heavy machinery until they know how benzo affects them, because benzo can cause sedation, okay? Now, the antidote for benzodiazepines is flumazenil. So flumazenil is used in benzo overdose. And also, most benzo overdoses are managed with supportive care, such as airway monitoring, okay, guys? And that's about benzodiazepines you need to know, okay?